Hi, I'm Toya Brasky from Galveston, Texas, also known as Galveston Psychic Paranormal Researcher. Today I have a surgery visit with plastic reconstructive surgery to discuss my upcoming surgery, which is in 15 days after today. It will be on August the 20th. I only have 6 work shifts to complete, and then I'm off for 6 to 8 weeks. So obviously the breast reconstructive surgery that I'm having is quite serious and complicated. I realized that in my nervousness about the procedures that I'm going to have happening, I need to look at my consent form again. The reason for that is that I remember looking over the part of the complications that were very serious, like capsular contraction of the breast implant. So I'm going to receive an injection during or after surgery to help prevent that. The other thing was, because I'm having a breast lift, a breast lift, one of those incisions is a vertical incision and then around the nipple. They do leave the nipple attached to a blood supply, but then they have to move it up. And one of the complications of that could be that you wouldn't get enough blood supply to that nipple, and you could have necrosis of the nipple. Imagine signing a released form that says that that could possibly happen. Also, there's the risk of any kind of complication where your body rejects the implants, infection, a lot of very serious things. But I don't remember looking at the actual procedure list. So we have went back and forth on my case about whether I was going to have a total mastectomy because I have so many masses in my breast. I have 10 to 20 masses in each breast, some large, some small. During my biopsies, I brought up the concern that they only biopsied one mass in each breast. That did not make me feel confident. I felt like, because my mother is a breast cancer survivor, that was just not enough. And I felt like they needed to do a more in-depth biopsy. So my surgeon changed it to, I'm going to have a level 5 pathology gross biopsy during this surgery on August the 20th. They had originally wanted to do a mastectomy, which that could still be on the list. But in my final consultation, I said that I did not want a mastectomy, that I wanted the total capsulectomy, which is removing the old breast implants that have ruptured, because in my 20s I had mastectomy implants for 2 lumpectomies that left my breast uneven. Those lasted 40 years and then they ruptured in my chest, so I have ruptured implants, silicone implants in my chest right now. That has caused scar tissue, it has caused pain in my breast. So they have to cut that out, and that is called a total capsulectomy. They will be removing the implants which are underneath my muscle. So then they are going to do what is called a breast implant exchange. I said that I did not want an implant under the muscle. I want it over the breast, or in the breast this time. So they are going to put a new implant in my subglandular tissue. So that's two procedures already. That is the capsulectomy, then the breast implant exchange, and then I'm also going to have a breast lift, which is called a um, a mastopexy. So obviously this is a lot of cutting to my breast. They are going to remove lymph nodes, which are underneath my arm, and do level 5 pathology on that. They are also going to remove tissue in my breast. They are going to have to cut me all the way underneath my breast on both sides, split that open to take out the capsules that have formed of scar tissue. On the breast lift, they are going to have to cut a vertical scar, take out excess skin, cut around the nipple, reposition that. It's a lot. It's really very scary. Then I haven't even thought as far as when they're doing a live time pathology examination on me on my lymph nodes, which they will probably use, I think it's called a sentinel lymph node biopsy, where they put like methylene blue or a radioactive dye that's injected near the site of the masses. And if any of your lymph nodes turn blue, it means that cancer has spread to your lymph nodes. So they'll be doing all of that during this surgery. So there's a lot of things that have confused me. Today when I go, I'm going to definitely say I need to see the procedures that are being done on that day, because we've went back and forth. We've talked about a lot of things. We talked about, well, if the insurance didn't cover this or that, then it would only be an implant exchange. Well, because of my case being so complicated with so many masses, my mother being a breast cancer survivor, past reconstructive surgery, ruptured implants, it is a lot. So the insurance did cover 100%. Well, they did cover all of the procedures as medically necessary. So I'm lucky for that. But I've seen like 3 different things on my medical records. I've seen total or mastectomy simple complete. And then I've seen breast insert after mastectomy. And then I've seen on my actual surgery day where it only has 3 procedures. It has capsulectomy, breast implant exchange, breast lift, which is mastopexy. That I always get that wrong. So I'm sorry, I have allergies. So the pollen is really bad in our area right now, and it's just tearing me up. Anyway, I'm trying to keep a very lighthearted spirit. I have been so down the past couple of weeks with fear about what's going to happen during this procedure. I've been confused about what I need to do, what is the most healthiest thing for me. I was very surprised that the implant size that was ordered for my breast was between 600 and, maybe 635 cc's to 700 cc's. That is a huge implant. But I'm thinking, because they have to remove tissue, what they do is they actually measure all the way across the breast like this. So they're taking measurements, and they have to have an implant that is large enough for the pocket that's being cut and the tissue that's removed. So I already have very large breasts naturally. The implants that have ruptured in my chest are completely flat. They're underneath the muscle. They are not in my breast. So this is all my breast right now. It is a D cup. So, I mean, see, I already have very large breast. And this is all my breast. It is not an implant. So, when they remove tissue, they have to fill up this skin again. So they ordered high profile. They have two different sets of implants. They have one that's in the 600 range, one that is in the 700 range. So that seems really, really large to me. That seems like, and she did tell me, she said, I'm not going to make you grotesquely large, but you are going to be a little bit larger. Number one, because it's a high profile implant. So instead of being flat and round, they're going to be more projected like this. So they will have a very projectile look. And believe it or not, when I first went to the surgery office, I told them that I would probably like to have a reduction. I actually asked them if they could take my breast, cut it in half, and just cut it right here and make them into maybe B's, small, like large B's. I wear a D cup now. They said that I didn't have enough skin or muscle to do that. So I was back to how to reconstruct my breast to come out about the same size, but to be reshaped. And also, because I'm 61 years old, I don't want to put a large implant in my breast and have them sag. So I did agree to the mastopexy, even though initially I was adamant that I would not do that. I said I didn't like the scar. I hated the fact that they have a vertical scar and then a scar around the nipple. I just thought that that was awful. I had the misconception that an implant alone would raise my nipple and make them more perky. That is absolutely not the truth. An implant will not raise your nipples. It will not raise your breast. It will basically make them fuller, but your nipple will stay in the very same position that it is. So don't let anyone ever misconceive you about that. So I had to apologize to my surgeon and tell them that, I'm sorry, I got to touch the phone or it will try to cut off. So I had to say to my surgeon, I'm so wrong for telling you that I was right and you were wrong about the implants. I really thought that it was kind of like stuffing a teddy bear, like the snout of a teddy bear. And so if a teddy bear's nose was not stuffed and then you put more stuffing in it, then the nose would eventually get to the desired effect if you stuffed it more. So that's what I thought with a breast implant, that they can just put a breast implant in, and the more that they stuff it, that your nipple is going to come up here. That's not true. They can put the breast implant in, and if your nipple is somewhere down here, it's going to still be down there when they put the implant in. So I thought about it, and I said, my nipple is maybe here. They're not up here anymore. They're maybe here. So after much research, going over case after case and seeing that I was completely wrong, that the breast implant would not bring my nipples up whatsoever, and even worse, after implant surgery, especially in the breast tissue, that heavy implant after the surgery could drop in what is called ptosis. It's spelled Ptosis, which means breast droop. Ptosis could get worse with an implant because of the heavy weight of it. So that scared me so bad that I said, you know what, I'm just going to have to deal with the vertical scar and the scar around the nipple. I'm actually going to tattoo cherry blossoms underneath my breast and a tiny little cherry blossom on the scar that goes up to the nipple. I have a picture of that on my Facebook and my X page. So I agreed to have the breast lift because I'm 61 and I don't want to have just large implants replaced in my breast and then have hanging breast. So I did agree to the mastopexy. Something that was confusing to me is, okay, they tell me to buy compression bras. So I'm just going to show you kind of like what the confusion is. So, they tell me they need to be skin tight. They need to compress. So I bought 4 of them. I bought 2 with zippers and 2 with kind of like a panel that can be adjusted that has hooks and eyelets. So the first one that I bought was this one. So I'm just going to show you. So basically it's a bra that has like adjustable straps, so you can adjust this Velcro straps, and it has all of these adjustable panels right here. So when I initially bought it, okay, I'm going to try to put it on. Okay. So you go to the surgeon's office and you have to try these on in front of the nurse because they have to make sure that your garment is going to be tight enough to compress your breast. So this is one of the first ones that I bought. And so my idea, it's already tight just right here. My idea, and this is just with my natural breasts, this is before I had breast implants, is I thought, so I bought this in my normal size, which would be like a D cup. And they explained to me that it does need to have cups. It should not be like a sports bra that is flat. They actually want your breasts to be rounded in a cup but still compressed. So these do have cups. So I thought that you buy it and then you skip all the way over here to the first rung of eyelets. So I don't know if I can get all of them together, but if I did that, I'm not going to try to get all of them. But if I did that, at this point, this feels very tight to me. It feels like it fits and that it's tight enough to be compression. So I showed this to the nurse and she said, no, it is not tight enough, that I need to go down 1 to 2 sizes. So I thought, well, how tight is it going to be? Because the band feels pretty tight. I mean, it's not digging into my skin, but it feels very tight. This does hug my body. And how does that make sense? Because if my breasts are going to be even larger after the breast implants, well, this should fit fine. But she said no. So I have 4 bras that I bought that I cannot use. So then I bought new ones. So the next one that I bought was this one. It's exactly the same bra, but it's 2 sizes smaller. So it is really tight. It is like, good grief, like, okay. All right. So, all right. Let's pretend that I'm naked. All right. So she said one of the things that I did wrong was when you're trying on your compression bra, you're not going to go to the first level rung of, you're not going to go to this level over here to snap it. When you try on your compression bra, you're going to go to the last rung of eyelets. So, so at that level, dang. See, the zip-up kind was easier for me, but they said they don't like the zip-up kind. So Look, this is a lot of work. This is a lot of work, y'all. Okay. So, uh, oh my God. So, so this is 2 sizes smaller. And it has got me hugged in. I mean, it is like tight, skin tight. The band is tight. The bra is just holding me in. So she said, this is perfect. This is what I should have ordered. And I thought, as your swelling goes down, you loosen it. You start here and you loosen it. She said, no. She said, so right after the surgery, I'm going to have it on the very last rung here, and it is skin tight. And so with implants, if they're going to be larger, I can already feel, I mean, it is really going to be compressed. There's still room, but it's going to be definitely compressed. Okay. So then she said, as your swelling starts to go down, because they said that I will have massive swelling in my chest and also my torso. So if I look really hefty after the surgery, if I come on and do a video, I'm just telling you now that they tell me I'll have fluid in my torso for several weeks and also fluid in my chest. It'll take a long time for all of that to go down. So she said, as your swelling goes down, then you start to move these closer and closer and tighter this way. So I had it all wrong. So I have this one that I bought, a brand new one. And I bought another kind that comes down a little bit lower. They may or may not like that, but it's also a smaller size. So, and they want me to wear this 24 hours a day for 6 weeks at least, every day. So, that's a lot. All right, these babies had to get out. All right, so before I go to the doctor's office today, I just want to let you know that I'm letting you see my cleavage for this video for the sake of talking about breast. But before I go to my doctor's office, I actually have a white tube top that I will put under this dress, because the doctor's office is not really the place that people want to be sitting in the waiting room and staring at my cleavage. I am modest in that way. So, I am very nervous. I'm very worried. I just went to the internal medicine doctor yesterday, and they put me on high blood pressure medicine. Those were concerns of my surgeon. She said, you have to get your blood pressure down before this surgery or it's going to be messy. And the minute she said that, I said, I'll go to the doctor right now. So I hope that everything turns out beautiful, that I'm so glad and everything comes back normal. My sister, who's an RN, will be taking me to the surgery and picking me up, but pretty much after that, I'm taking care of myself. I will be off from work for 6 to 8 weeks, which is necessary recovery time. I can't go back to work before that. It's been a financial burden to me because throughout this process, all the way from February to August, I had to put up the upfront money to cover my deductible for several things, like 2 biopsies, several radiologist tests that were very, very expensive, going back and forth to the doctor for blood panels, for every kind of test you could imagine. Not only did I have to pay my full deductible and monthly installments for my insurance, they told me that I had to come up with $3,361 before they would even do this surgery on me. And I only make $2,200 a month because I'm only working a security job at this time. I used to be a state of Texas employee 3 times in my life. In fact, I was mostly a government employee all of my life, most of my life. So, working a security job just is not covering this medical cost. So I was panicking up until about a week ago. I was absolutely panicking. I was down to the point that I can't pay any of my creditors. I could not pay my landlady. I had to go have a conversation with her, and luckily she understood, and she said, "Baby, take care of yourself. Have this surgery, and then after you have your surgery, you can pay me rent. Don't worry about rent at this time." So even with not paying rent, I still have utilities. I have creditors calling. I still have food costs, pet costs, everything. But almost, I would say, 85% of my check is going towards medical procedures before this surgery, plus medications. My insurance only covers so much of the medications. In fact, some of the medications they'll be using for this surgery are not even covered by insurance because they're new on the market. There's so many things. So there's a part of me that I was trying to cheat and say, can I go back to work early? Because when you're poor, you're thinking, oh my God, every day counts. If I can just go back to work early, if I can heal faster, it won't be such a financial hit. But my doctor's office was like, no, you can't. If you do that, you're risking hematoma, you're risking capsular contraction, you're risking bleeding, all types of things. This is one of the times in life that you're just going to have to say, I'm sorry, I can't pay you at this time. I have to take care of my medical bills. It's very humiliating. And that's all contingent upon everything goes well with this surgery, that there's no surprises, that during the level 5 biopsy by the pathologist that they don't find cancer. If they find cancer, I don't know, I'm screwed. But I hope it turns out to be happy, that everything goes extremely well. I am very confident because my plastic surgeon is the chief fellow of plastic and reconstructive surgery at University of Texas Medical Branch. I really trust her. I trust the surgery team. They weren't always happy with me because I'm the type of person that I'm going to ask a million questions. I want to be informed. I was a little bit stubborn at first because I thought that I was right, where I could probably just get a breast implant exchange. They could take out these ruptured implants and just put an implant in, and then I would be done, and that my breasts would look amazing. That's not the truth. So I had to kind of like, just kind of like wilt away and come back with my tail between my legs and say, I was wrong. I was completely wrong. And I'm pretty sure that the surgery team knows what they're talking about. And even things like, the implant size being 600 or 700. At first I was like, are you sure? Are we talking about the same thing? That's kind of big. That's like really humongous. And so they were like, well, because of the size of your breast, we have to pick a large implant. So sometimes you go in with a preconceived idea of what you're going to get. Like I was thinking maybe I would get 400 cc's, 500 cc's maximum. That will not fill up the sac of my breast. So I trust that they're going to do what they're going to do. They ordered 2 sets so that way during the surgery they can try both sets to see which one really fits my breast the most. Somewhere between 600 and 700 cc's. That seems huge. Anyway, I'm going to have to leave in a few minutes, and probably before I go to my appointment. Like I said, I'm going to put a tube top underneath this, a white tube top, because I'm not going to sit in the doctor's office, which is a very populated, kind of affluent hospital area. There's no way I'm going to go there and sit in a waiting room with cleavage. So I'm much more modest and considerate than that. Anyway, wish me well, because I do have anxiety. This has been a very difficult thing for me to go through emotionally as a woman, physically on my body, and financially. But anyway, let's hope let's hope that it goes well. If you're noticing that I have a redness in my face, I have really been concentrating on doing exfoliation. I like to actually compound my own beauty products, and so I had bought kojic acid, maldaic acid, and also hyaluronic acid, and mix that with aloe vera, vitamin E oil. I've been using that for about 15 days every day on my face and my upper chest and neck, and it has been exfoliating skin and dark spots from my face. So my complexion is getting much brighter and more even. But you can see I've got some red spots here where it kind of chafed my skin because it is very strong. And so it kind of reddened this area. It's kind of actually raw today. But I think that my complexion is looking, can you see it? I think that my complexion is looking brighter and brighter, and I'm very happy with it. I can either make a liquid skin lightener and exfoliator, or I can make it into a cream. But you can make these things yourself, relatively very cheap, and it lasts a very long time. So those are things that I'm working on. And also, my breasts are really mostly large because I gained 50 pounds. All my life, I weighed about 150 to 160. When I retired from the state of Texas as a correctional officer, I was many things. I was a EKG telemetry tech in ICU and also cardiology at 2 different hospitals, a certified EKG specialist and heart telemetrist. I used to do the interpretations of all the surgery and ICU patients for the doctors in the morning. I also did major campus security for a state of Texas university. And then in the end, I worked for the state of Texas as a correctional officer, a level 4 officer. Finally, in 2023, I decided to voluntarily resign from that job because it required travel. Sorry, there was a bug in the room. It required travel all over the state of Texas, which was something that I did not want to do. Unfortunately, when I resigned, I lost my state of Texas benefits, like fully paid insurance on top of my salary. So I had to rely on government insurance because I'm only making about $2,200 a month working security now. So, excuse me, I have severe allergies. Anything like that's a speck of dust coming through the room will cause me to choke. But anyway, one thing that I would like to end this video with, I would love to tell you that with all my heart, I am so thankful for Obamacare. I am so thankful to you, Barack Obama. Thank you so much for Obamacare or healthcare.gov. I don't care what anyone says about it. When you were in office, the plans were absolutely wonderful, the best. When someone else came in 2016 and changed those, a lot of the plans were absolute crap. But they still exist. And one of the things that has saved me is the fact that under the healthcare.gov guidelines, they cannot deny you for pre-existing conditions. Had I been on a private insurance trying to cover these procedures, they could have absolutely said they're pre-existing because I had breast implants from reconstructive surgery, mastectomy implants put in 40 years ago. And then they ruptured just at the beginning of 2025. So they could have absolutely said all of this is pre-existing, we're not going to cover it. But under healthcare.gov, they had to cover it. It's the law. So thank God for that. I will never, ever be ashamed of using healthcare.gov. I worked for the government for a good number of years. And there are times that all of us need help. And this is a time that I really needed help. So thank you, Barack Obama. Thank you for what you did for millions of people who needed health care and got health care for the first time in their lifetime. That saved so many people. I'm still ashamed that America does not have universal health care for everyone. No one should have to go through what I'm going through this year, where over 75% of my income is going for health care costs. I'm completely desolate. There's nothing that I can do about it. There is basically no help to me. The only thing that helped me in the end was, see, hospitals now, if you don't have insurance, if you can't pay your full deductible plus your out-of-pocket, they can absolutely, if it's not a life or death condition, if you're not in trauma from a wreck or a heart attack, they can say, I'm sorry, if you don't have the money, we can't treat you. So, excuse me. These allergies are about to take me down. So, last week, I was literally at the point of crying. I was just like, I just don't know how I'm going to come up with $3,361 before August the 20th. That was what was required on my estimate as my part and my responsibility. So I knew that with my paychecks being only $550 a week, that the best that I could do was about $350 to $400 a week out of my paycheck. So I knew that by the surgery date, I would only have about $1,600. So I started panicking that I've waited from February till August to have this surgery just because of finances, because I couldn't miss a single day of work and afford to come up with this out of pocket money and my deductible and the co-pays and all of the things that I've had to do. So I started panicking. I said, oh my God, you know what? They have turned me down one time. One time I showed up for my biopsy for my breast masses, and that morning, they didn't contact me before that. That morning they said, you owe $1,000 today. I didn't have $1,000 on that day. So they tell me, guess what? Well, we can't treat you today. I felt so humiliated. It was like the worst feeling in the world to have to walk out of the hospital in front of people after you've been told, I'm sorry, I can't treat you because you can't pay the full amount today. No one should ever have to go through that. Knowing that my breasts are full of masses on each side, and to tell me, even though you're going to get insurance money, you're going to get about 70% of $6,000 for this biopsy, but you're going to turn me down because I don't have $1,000 today. It was terrible. So I knew that I had my surgery coming up August the 20th. And I was thinking, I'm giving everything I've got out of my check. I'm not paying rent by the grace of my landlady. But I still have high utilities. It's summertime where the electric bill is sky high. My cable, not my cable, I don't even have cable. I'm trying to stream on the internet. I have to have internet because I have to have communication with the hospital. I have to have my telephone. AT&T is outrageous. I feel like they're ripping me off, but I have a contract with them, so I have to pay it out. I still have to have food. I will not have an income for 6 to 8 weeks. No income. My job does not have paid time off. We have no sick pay, no vacation pay. Well, a new company is taken over, and I think I don't know. We don't have a lot of benefits. So I literally have no pay. So my living room, I only live in a 500 square foot house. In the last month, I've had to buy supplies. I've had to buy extra food, extra pet supplies, extra, like I had to get button-up pajamas because I'm not going to be able to raise my arms. I had to get wedge pillows because I have to sleep elevated. I had to get a bed frame to put in the living room because I can't sleep in the room with my dogs for the first 4 to 6 weeks because they could accidentally injure me by jumping on me or something like that. So I'm putting a bed in the living room. So I'm a person that's meticulously clean and organized, and this has drove me crazy. I hate it. My living room has looked like a storeroom in the last month because I had to store all of these things that I'm going to need because I won't be able to drive for at least 4 weeks, 4 to 6 weeks, actually about 4 weeks. They tell me no driving, none of that. No picking up anything heavy. So I had to buy large cat and dog food bags and separate those into smaller containers. I had to buy button-up pajamas because I'm going to need those since I can't lift my arms. So I got 3 sets of pajamas. All of my bras are open front. I got paper plates and paper bowls and utensils, lots of paper towels. I got about 4 cases of Dr. Pepper because I'm a Dr. Pepper addict. I got about 4 giant cases of Gatorade. I had to get, food that is going to last 6 whole weeks because I have no income. And then when I return to work, I have to have a doctor's note saying that they've released me back to work, which will be about October the 1st. And then it'll be at least a week to 2 weeks before I get a paycheck again, because 1 week is kind of held back. So I'm going to be just destitute. I hope everything goes well. I hope that there's no complications. I hope that I'm able to report that everything is fine. Sorry for this being such a long video, but I did want to let you know what is happening. I'm glad in the last couple of days I found an injured possum that my dogs had accidentally attacked in the backyard. And Chazzy, the possum, has taken my mind off of some of the worry, because it's kind of a distraction to take care of something else that is injured instead of worrying about my own complications. So I believe with my whole heart that God sends angels disguised in many ways, and a lot of times angels come to us as animals, and they uplift us and they save us. We think that we're saving them, but actually they're saving us. So Chazzy the possum is taking my mind off of my worries about surgery and kind of giving me some joy in rehabilitating him. Thank you for listening to my story today. Bye.